Hello, my name is Donald Mullany, and I will be your host for the next half hour. I'm on my way to meet with some people to talk about MIELI Without Borders on the topic of loneliness, and a bit more about the organization in general. We are meeting up at Lappenlahteladen in Helsinki with people to discuss this topic, and later we will have Anna check in to tell you more about the organization and what we do. You may well ask why we are talking about loneliness or isolation in general in a country that is consistently regarded as one of the happiest countries on earth. You may also ask why the loneliness initially reported by almost all sectors of society during the COVID-19 emergency measures are still at troublesome levels this long after these have been lifted. Are you ready to hear our story? Come with me. Let's take a journey together. While we are on our way, let's begin with some background detail. What do the statistics say? Any story needs to start somewhere, and the best place to begin with is the European Union's initiative to address mental health awareness, to destigmatize issues and experiences around mental health perception within the EU in general. It took a global pandemic to stress the health services of many countries worldwide and to expose cracks in many health services for one or another reason. During and immediately after the pandemic, many health and crisis centers faced an inundation of contacts for which they neither had the personnel nor the skills at hand to manage as effectively as they would have liked. Several papers have been released over the past 3 years by universities and state departments in Finland around the question of how are we doing, and the statistics suggest that it is not great. These topics cover employment, social connection, and other general types of social isolation one may describe as loneliness. To be clear, there are many different types of loneliness, and different physical and attitudinal circumstances that contribute to a feeling of loneliness. But we are not going to dive too deeply into the psychology of those. We are going to stay within the boundaries of the understanding that if a person does not feel part of an accepting group, or cannot easily contact somebody important to them, or is not able to share physical and personal expressions in a meaningful way, then they may be considered lonely. Most everyone would not be surprised to learn that elderly people are generally considered lonely, as aging and infirmity reduce their opportunity for regular social interaction and new contacts. What most everyone would not expect to be coming through these surveys are alarming trends over all of the population segments since the COVID-19 pandemic. This is especially true of the youth and amongst immigrant populations. Numbers from Statistics Finland. According to Statistics Finland, 29.7% of persons aged 16 or over felt lonely all of the time or most of the time in 2022. The share of persons experiencing loneliness grew in all age groups from 2018, when the share was 21.2%. Persons aged 85 or over experienced loneliness most, while persons aged 16 to 24 second most. A study by the University of Eastern Finland in 2019 further reported that social isolation and loneliness are not uncommon experiences amongst recent immigrants who are often forced to leave their families and social networks behind. A third of the respondents reported feeling lonely often or all of the time, while over a third, or 35%, had only one or two close Finnish friends. Over half of the respondents, 52%, had no Finnish friends. Crisis Centre contact requests have significantly increased in volume numbers and across certain population segments. Self-harm and suicide report numbers have remained persistently stubborn, but do not exceed the annual average over the last 5 years. This suggests that more people are aware of their mental health state, are monitoring and tracking their mental health state, and are asking for professional assistance if they feel that they need it. This trend is a double-edged sword, unfortunately. While it is encouraging that mental health issues have become destigmatized and are more openly discussed in a normalized environment, it is less encouraging if this process impacts existing healthcare facilities and causes distressing experiences while attempting to access them. If health services have been established to deal with a crisis situation for mental health topics, then they are usually unsuited to deal with a volume of contacts that are classified as fairly low risk. In practice, this creates tension between the urgency of what defines a casual user and what defines a critical user, where if both are scheduled to consume the same finite set of resources. If health authorities have constrained resources, for example, post-pandemic availability of skills shortages, or perhaps an austerity-focused recruitment policy, then this situation will deteriorate in a short timescale. This pressure appears to be confirmed by the Healthline Statistics report from a Helsinki Times article on the performance in 2022. MIELI Mental Health Finland's crisis helpline noticed a record number of 400,400 call attempts and confirmed the increasing trend in youth contacts, where, since 2019, the number of callers under the age of 30 has increased by 88%. There is a grey area between asking for help and really needing help that certain organizations have been created to fill in and to exist in this space. The organization we are discussing in this podcast is one of them. MIELI Without Borders is a volunteer-staffed organization that exists in this grey area. Here is how Anna from MIELI Without Borders describes the organization and what it does.
Hi, I'm Anna, and I'm the chair of MIELI Without Borders. MIELI Without Borders is a migrant-led member organization of MIELI ry. It was founded in May 2022 as an outcome from I Am Suomi 2 petition. In MIELI Without Borders, we promote mental well-being and equal access to mental health support. We focus on the awareness of mental health and well-being. All our board members have broad expertise in migrant work, mental health, and integration process. MIELI Without Borders doesn't work hierarchical, but relies on the expertise of its community. That makes our services accessible, trustworthy, and approachable. What we want is that mental health is no longer stigmatized. We want to raise awareness on mental health among foreign speakers in Finland, including mental health support and well-being as an integral part of integration process, and we hope and wish for a cultural appropriate mental health support among service providers. Our beliefs are that mental well-being should be an integral part of the integration process in Finland. Anyone, regardless of language skills, ethnic or national origin, ability, gender, religion, and/or status in Finland should have access to mental health support. Why? Because in order to be active members of a society, we have to be okay.
Why we are discussing loneliness in this podcast is that it is the most personal quality that we can address at the most personal level. It is the easiest to identify experiences that generate this feeling of an emotion, yet at the same time one of the most complex emotions to unravel and build a resilience towards. Loneliness may be triggered by isolation, be that physical isolation, such as in the COVID-19 lockdown measures, or in social isolation, that in turn might feed and reinforce those feelings of loneliness. Physical isolation, for example during the pandemic countermeasures, generated reports of a feeling of loss that was called skin hunger, where individuals would be compelled to break their quarantine instructions simply to join groups of other people and be with them, even if the risk of contagion was high. The flaws and unexpected ramifications of society-wide containment strategies are evident long after the pandemic has passed to epidemic proportions. This phenomenon clearly demonstrated that human beings are, in fact, social animals, even if this awareness has waned over the course of modern society. Social isolation is as relevant as physical isolation in creating feelings of unease and loneliness in social animals. In the same sense, social expressions of exclusion and discrimination may invoke feelings of loneliness based on any number of social triggers, be it language barriers, access to services, social stigma, or cultural differences. These are all topics that have deeper discussions and insight associated with them. We are not going to analyze or focus on them in this broadcast. We are more interested in where our members might feel lonely and how they identified this feeling. It goes without saying that once a person identifies these feelings, they may compensate for them and begin to work towards resolving this tension within the means at their disposal. Needless to say, MIELI Without Borders is positioned to increase these means and to provide additional instances to improve the skills with which to address these instances. Let's hear how two of our people share their experiences with us. Come with me and let's meet them. What are your experiences with loneliness?
Hello, my name is Michelle. I am a psychologist from Colombia. I have lived in Finland for about 2 years, and during this time, I have had many positive experiences and also some difficult ones. I believe that most of us as immigrants have noticed that living in a new country can be exhilarating and overwhelming, and have found differences between Finland and our home countries. Some of those are wonderful, and others can make us miss our country's system, culture, language, or even aspects such as food or weather. Also, based on my experience after having a fracture, I can admit that when you are in a hard situation, feeling pain or having limitations to do things by your own, you wish to be with your family and friends, receiving love and care. But when you are far, you just want to bring them happiness and don't give them reasons to worry because they really can't do much for you. However, being open and ask for help, even if they can just listen and understand you, gives you relief and comfort to continue and overcome any situation. As well, it's important to be open with the ones around you, the ones you can trust, because sometimes we see just the dark side of the moment and it feels that nothing has sense. So, getting help from a close person can help us to open our minds and see options or alternatives where we only see the problem. Also, visit a professional or a mental health organization can provide us tools to deal with it. Change our perspective, see an opportunity in the midst of chaos, and learn to manage and control our emotions, anxiety, or depression. On the other hand, I have to admit that another aspect that has been difficult for me living in Finland has been the language. Receiving medical care in a second language is not easy, and even more so when the professionals have limited English, as it makes difficult the interaction and understanding. Taking into account that some people, generally children or older adults, want to tell you something and you don't understand what they are saying or what to answer. because despite having a basic knowledge of the language, sometimes it's essential to speak the language of the country you are in. But learning is made easier or more difficult depending on the person and a lot of factors, such as time, motivation, work, moving to another country in the future, among others. But only you can decide if it's worth learning the language or not, based on your objectives and life goals, along with your interests and time. Finally, it pains me to acknowledge that in the 21st century we still struggle with issues of discrimination and isolation at some workplaces, especially towards immigrants, and you are not alone to face such challenges. Workplace isolation driven by discrimination or prejudices is a serious concern that affects not only the individual but also the collective environment of the workplace. However, facing this adversity with resilience and seeking solutions can lead to positive change, not just for yourself, but for future generations of employees who deserve to be treated with dignity and respect. Empower also yourself with the knowledge that you belong in the workplace just as much as anyone. Open and honest communication. Share your experiences with trusted colleagues or supervisors who may be unaware of the challenges you are facing. If the isolation becomes overwhelming, consider seeking the assistance of a mental health professional. They can provide you coping strategies, emotional support, and guidance on navigating workplace challenges, and use the legal mechanism and work protections institutions to share your case. You are not alone. And remember that immigration is not just a change of address, it's a transformation of our entire world. And your presence here today can show your strength. It's crucial to remember that adapting to a new environment is a process. So we encourage you to immerse yourself in the local culture, meet people from different backgrounds, try to cultivate a new support system, connect with other immigrants, join community groups, set realistic goals, establish routines, engage in activities that interest you, bring you joy and peace. Personally, these tools and strategies have been important for me while feeling lonely. So keep yourself positive with positive thoughts, surrounded by people who support you and understand you.
Moment in which I felt the most lonely was when I was unemployed. It was when I just arrived in Finland, and I guess it was also a combo of all of those two things, which was the fact that I was like arriving there, I didn't have a job, and I didn't know the language, and I just like got to find a way through everything, trying to understand how everything works around here, and not being able to understand like what was going on around me, because I couldn't understand anything, and I couldn't understand anything that was written around me. And yeah, there's this kind of false idea that like anyway everyone speaks English, so like you don't really have to learn the language, but that's really a false idea that kind of people like get around. And I mean, but you kind of like very fast understand that it's not as simple as that once you have experienced living in Finland for a while. But anyway, when I was unemployed and arrived there, I felt very lonely. I was not sure at all how to like get around Finnish people. And so in this confusion of being lonely, I just find a couple gigs here and there, but it was like I was in a precarious state, and like it's even harder because usually when you have these like negative feelings, you're kind of having different layers of negative stuff. So here, being unemployed, not having any social circle, then feeling lonely, and kind of like everything is piling up like this. So it's really hard to kind of like crawl your way up there. But I guess like one of the solution that I find to it, or like I guess two of the most relevant things that I did was do an activity that I would enjoy doing that would be in a social context, and that would be an activity that I would enjoy anyway, that I would do even alone, but that would still make me meet some people, which is climbing, a sport that I enjoy. It's really a sport that I could do alone, and like that's what I did for a while, because I couldn't I didn't really dare to speak to anyone that much, because it was hard to, I don't know, I didn't know if I would bother people or anything. But yeah, anyway, I just climbed for a while, and then and like overall, then after a few months, then people starting to see me, like the people who go at the climbing gym in which I am, starting to identify me as like a guy who comes often, and then you get to exchange a little with people, and then like relationships slowly built on that. So kind of like building a social circle of Finnish people. That's how I did. But it took it took more than a year, I think, like overall, to really find people that I'm like feeling comfortable around, and that I think feel also good around me. So that would be the first part. And second thing is I really as soon as possible, as soon as I could, I enrolled into Finnish courses, and then doing so, I met some people who were in similar situation than I was, and so people that I could connect with, and yeah, it was feeling great to find people like this, and just like move forward together and kind of follow each other in the different course while we're moving forward in terms of like our Finnish level. It's and kind of like motivating ourselves to come, like to go again and stuff. So like yeah, this made me more have a social circle of international people, but it was very nice as well to just share a similar experience with other people, and kind of like share the same struggles in terms of like learning a new language. So yeah, those two things really helped me in my journey getting out of loneliness.
MIELI Without Borders activities. MIELI Without Borders offers informational services through their website, with FAQs and a range of languages for greater understanding of how to access or how to use mental health services in a way that destigmatizes the need for such services. MIELI Without Borders also arranges a set of volunteer activities geared towards involving people in presenting opportunities to meet in person and share in building an inclusive society of immigrants with different backgrounds and experiences. These range from general organization meetings to focused workshops presenting topics designed to enable immigrants in Finnish society and present additional concerns. The range of activities is specifically intended to reduce feelings of isolation and perhaps in turn provide positive steps and self-help tools to combat feelings of loneliness. Workshop topics cover mental health awareness tools to monitor mental health awareness states and recognize triggers when they occur and how to manage them. Toivo groups and activity groups cover in-person opportunities to increase a sense of connection and gather with other MIELI Without Borders members. The primary contact point for all prospective members is the MIELI Without Borders website at MIELI Without Borders /fi. But what exactly is someone to do if they are feeling lonely? According to the Murphy report, loneliness is as big a health risk as, for example, smoking 15 cigarettes a day or being chronically obese. While these conditions have health prescriptions to combat them, very little readily accessible mental health awareness exists for the conditions of chronic loneliness. If MWB has current and future programs planned to alleviate and combat these conditions, then follow-up programs to encourage citizens in the following 6 mental health awareness practices would be most useful in accomplishing the task of reducing loneliness in Finnish society. Reaching out. Acknowledging your feelings of loneliness and reaching out to friends, family, local groups, or trained professionals to seek support in defining and begin to combat these feelings with guidance from others. Self-acceptance. It seems counterintuitive that greater self-reflection, journaling of thoughts, and evaluating your self-worth or self-esteem makes it easier to meet and interact with others more meaningfully. Gratitude. The practice of gratitude for what you have and what you have accomplished so far can greatly assist in offsetting feelings of inadequacy and marginalization. Marketing campaigns in social media constantly bombard individuals with reasons to acquire things you may not need. Practicing and developing gratitude for what you already have greatly assists positive feelings and reduces feelings of loneliness. Gratitude helps build resilience and contributes towards increased feelings of happiness and reduced chances of depression, combined with various other types of professional support. Reduce social media use. Some social media interaction is beneficial, but a great deal is not. Excessive social media consumption triggers feelings of loneliness, especially in young females under 25 years of age, which is the fastest increasing segment reporting loneliness. Replacing social media consumption with authentic social connections is recommended. Authentic social connections means giving to others or volunteering in small ways to provide a service to others in another recommended way to combat loneliness. Connections. Even small social interactions inch towards a connection with other people and permit small positive interactions. MIELI Without Borders strives to provide the entry point for recognizing and providing awareness of these issues around loneliness and provide some assistance to those in reaching out or those seeking meaningful social connections or hoping to provide some social service. Other organizations will be introduced in other broadcasts in this series, and I hope you will have the time to listen to what they have to offer. Thank you for your time, and I wish you well.